Good morning from America's newest news leader, or televis. And purchase your suggestions, please. Don't steal. Don't ask. Don't borrow. Pay for your suggestions at gofundme.com/all televis. We'll show you how to do it here, S1L5. Go to gofundme.com/all televis and pay for your suggestions. Don't steal it. We have a goal of $653. Amanda Mattal, William Mattal. Click the Donate Now button here, obstruction of me, and enter $653. Your settlement amount from William Mattal's office. Put your first last name, your email here, country, zip code 90057, Los Angeles. Leave a comment, say, think. Continue. Enter your code number, month, year, United States CVV number, and click Next. And you've paid for your suggestion. Thank you. We want to thank you from All Televis, gofundme.com/All Televis donate, or on Facebook, facebook.com/Vernon Merriweather, VERNON MERRIWEATHER, and send it. Here in Facebook, there's no excuses to pay for your suggestions. Facebook Messenger. Go to Messenger. Click the money button here. Choose your amount, $653. And click Pay. That's simple. Or Request. Request is sent. That's simple, folks. And you've paid for your suggestions via Facebook or GoFundMe.com. Thank you guys very much. Today's show is also provided support by Verizon. Verizon Wireless Unlimited cellular service. Switch now and get our best smartphones for free when you trade in your phone and sign up for Verizon Unlimited. Only from Verizon. MerriweatherA.Law. Cuatro Cliente Preferencia. We're watching Barefoot Contessa in the background. Food Network TV. Food Court. T-Mobile. Two unlimited lines, $100 all in. Get 2 lines of unlimited data for $100 with AutoPay. Taxes and fees included, plus activate HD video streaming and 10 gigs of high-speed mobile. Get 2 lines, unlimited $100 and save $20 on a Metro PCS. Cuatro Cliente Preferencia. AT&T, the new Galaxy S7, Edge Galaxy S7, now available with 0 down, only from AT&T. MerriweatherA.Law. Cuatro Cliente Preferencia. Sprint, total equipment protection. Narcolepsy, total protection, expert support, peace of mind, the most comprehensive protection and support available, only for $12 a day, $12 a night, $12 a month. Total device for your protection for your device. And your photos and videos get backup with the Sprint Gallery app. Automatically and securely stores your photos in a cloud and keeps them from Katrina. Available on your phone. Katrina Cloud Storage available on Sprint. Total equipment protection. Only $12 a day, $12 a night. Narcolepsy. And by the American Sleep Association, narcolepsy, cataplexy is a chronic neurologic disorder caused by the brain's inability to regulate the stable sleep-wake cycle. People who suffer from narcolepsy have mixed signals sent to the brain about when to sleep. Usually after meals. When it's the narcolepsy falls asleep, your phone's gone. Sprint, total equipment protection. Cuatro Cliente Preferencia. SteamPower.com. The Sims 3, it's virtual reality, not reality. He's a gamer, not a thinker. Rhino Cold Allergy Spray block what causes allergy symptoms and relieves nasal allergies. I know what you're trying to do. Rhino Cold, available from Muscarella. Free surgeries from the State Aid Department Controller. We'll be speaking to Tom Frieden in just a moment. New York City Department of Health. International Department of Health. MCI. Going to the prom early with MCI. MCI.com. Where's the home? Heather Howard, suddenly sweet. The Cascara latte featuring a cascara syrup adds a whisper of sweetness through subtle notes of dark brown sugar. Enjoy free standard shipping on orders $50 or more. E-commerce, E-Verify, Aeroscience. Nesquik, shake up the game, the post-game. Nesquik, available in raw berry, banana, and 2% milk. Bronx Zoo field trips. We have witnesses. Get 10% off total experience. Tickets from the Bronx Zoo. We've only been there one person. And The Sims 4. Virtual reality, not reality. Silly. It's a gamer. Yeah, we're gamers, so don't get the wrong idea. We're gamers. Fast forward this to freedom.
Use a condom.
Use a condom, exactly.
Theoretically, it's possible that there could be transfusion.
Let's simulate how they use condoms. You create, you control, you rule. Today is CDMAYORKREDITCardvardX3.59 MSNBC. Tonight on MSNBC, we have Andrea Mitrio live reports. MSNBC live.
It's not a broader risk, but it is an enormous challenge.
Today is 3X, not 59 MSNBC. Gel deodorant for ultrasound, baby searching. Well, why are they looking?
Ninth, the role of globalization and urbanization.
Why are they looking?
We have at least.
Why are they looking?
Visits from the U.S. to places
from the U.S.
where Zika is spreading.
Why are they looking?
We're not going to stop the world.
Why are they looking? This is V-Series.
Globalization and global travel has a lot of.
Why are they looking?
Productivity in interchange among people.
Why are they looking?
Ability to do what we do in the world, but it does also.
Why are they looking?
The inevitability of bringing risks closer to home.
On the phone.
Disease threat anywhere in the world.
Are you guys on the phone?
Right away.
MCI? Yeah. I don't know. You see me here on the phone.
In the Ebola epidemic,
what phone will he be talking about?
The first time we had seen urban spread of Ebola, which was
on the phone.
Finally, I'd like to say a word tenth.
I would like to say home.
Going on through CDC.
Hello, Mr. Frieden. How are you?
We often think of CDC.
We often think of CDC.
Boots on the ground, working 24/7.
Our returns were successful. We're going to say thank you.
But we also have
developed
new diagnostics.
New diagnostics.
Cutting-edge technology.
We donate to the CDC. Yeah, we donate to the CDC.
Better and faster.
Better and faster.
Traps that are effective.
And traps effective.
Knock down the spread of
entraps. They've admitted entraps.
Very simply.
In sleep, entraps.
Now we're going to see if that can
in sleep, entraps.
And we've been working for
a new class
that appears to be
non-toxic,
smells
a little,
and maybe as effective as
We'd
like to see how quickly we can get that
how
to the market.
quickly.
So rapid cycle.
Congratulations on your new career.
Important to protecting ourselves because
congratulations, Mr. Frieden.
We need to adapt also. We are learning more each
day.
We still don't know what proportion of women
CDC, Tom Frieden, resignation.
Give birth to an affected child. We don't know what proportion of the infants born without microcephaly.
Congratulations on your new career.
Impact later in life. It may be months, years, or even decades before we know that. We don't know the risk factors.
We don't know the risk factors.
But we're working very closely with Colombia, Brazil,
with Colombia,
in the U.S. to learn more.
The more
we learn, the better we can protect American women. In a public health emergency, speed.
Oh, these three quotes.
A day, a week, a month can make all.
On a Zika, in the last year, federal health officials have issued 60 travel alerts, deployed more than 1,000 experts to Puerto Rico. Zika hotspots initiated 25 major studies and tested more than 147,000 lab specimens.
It didn't happen, and within a few months, we needed 3,000.
That number looks weird.
The fact that we can
The fact that we
today
can today
potentially prevent
prevent
dozens or hundreds, even
thousands
thousands of birth defects
birth defects,
makes this an enormously
beer
crucial
control,
project.
Budweiser control,
At CDC, we are the center
barefoot
for
contessa
disease
control,
control and prevention, and we
control and
have the National Center
prevention.
for Birth Defects and Developmental
Returns were
Disabilities. The
successful.
experts there tell me that in their 30 years
Mr. Frieden, can you confirm your quotes?
they have not had a situation
147,000
this urgent.
specimens.
And I want to particularly thank Dr. McCabe from the March of Dimes and
Particularly
his colleagues for all
the
they're
march
doing
of dimes on our toes,
make clear how
the march of
extraordinary
pennies, the march of quarters. Thank you.
situation is. We now know that there are
We have a lot more to do
in the U.S., including
to control both Zika Nike
evidence of
and
infection
diseases spread by
and the number will
mosquitoes.
increase. We
Or
need to
NYU
ensure that we
physicians.
have
The CDC
resources
director
needed
also
to
said
treat this
researchers need to
emergency
continue to
as it
study
should be treated.
impact
And if you just look
of
at the
Zika
definition
on
of
fetal
what an emergency
health
is from a
beyond
supplemental funding request, it has three categories. It has to be
three
unexpected.
categories. We're reading
Well,
your
this
three
is not only
quotes.
unexpected, it's completely unprecedented.
Zika,
It has to be catastrophic. If you
Vern.
talk to any family of
Yeah,
a
it's
child
Vern
born
on
with
a
a severe
Zika.
birth defect, there could be no better
Quote number
or
1.
exact definition of a catastrophe. And it has to be permanent
Microcephaly.
Sadly, damage to the developing brain is
Microsleep by phone falls.
when we began preparing the
Sprint
emergency
in
supplemental
addition
request,
to
a
the
high-level
neurological
meeting and,
narcolepsy of your phone debilitating birth
in it,
defects,
how it go and
which
what
is
to do.
marketed by an
And
abnormal small
how
head.
is this going to
The virus has been linked to vision
And
and
this
hearing
goes from
problems,
very
severe
quickly,
irritability,
probably 3
trouble
months,
swallowing, epilepsy,
my jaw
narcolepsy,
dropped, literally.
cold, on excessively stiff
3
muscle
months.
tone in
An
infants.
epidemic is an eternity. Zika threatens that too many parents will have to
Too
have
many
the experience
parents
of not seeing their child grow to their full potential,
go to the full
graduate,
potential.
get married,
Quote number 2 on the path.
and we need to make sure
Currently,
all of us are doing everything
and
in our
future
power
infection
to
disease
minimize
threats.
the number of families
We've
affected.
dealt with Ebola,
We're not
H1N1,
going to
influenza,
eliminate
MERS,
Zika in the near
fungal
future.
meningitis. We're dealing now with influenza and drug-resistant bacteria.
Protect women. And
To
to do
protect
that,
women.
government funding is essential. Private
How does the
funding is
CDC
essential.
protect women?
Philanthropic funding is essential. Congress did the right thing.
Congress.
with Ebola, and I
We
hope
don't
that
know
they will do the
when
right
the
thing
next global health
with
threat
Zika.
will come.
And they'll do that without
We don't
making
know
us
where it will come from. We don't
stop a
know
battle in one
what the
part
pathogen
to fight
is
a
will
battle in another
be.
part.
But we are
We don't
100%
stop
certain
fighting
that
terrorism
there will be a
in
next
the
one.
Middle East to fight terrorism in Africa. One of the things that we had to do,
Nexus.
and we
Who's
found out in
Nexus?
these 3 months for a supplemental, was to borrow money from other parts
Who's
of CDC.
Nexus, Mr. Frieden?
That includes emergency preparedness
The
dollars that go
emergency.
out to Ed and all the other states to deal with things like
To deal.
leading
That's the next
response,
one.
doing lab
Quote
testing,
3.
tracking for outbreaks,
What he hopes to
responding
see from
health effects of
Congress
natural
and the new
disasters,
administration.
dispensing countermeasures.
During Dr. Frieden's tenure as
$50
director,
million of that money
it took
and
9
put it in
months
Zika.
on a political
States were
back and
happy
forth
about that,
legislators to
but we
approve
had no choice.
$1.1 billion.
We also had
Size
money
12.
that was broken
An
up
emergency
for
and like
funding
Zika
for
funds,
West
such
Africa
a problem could
and
be
used
addressed in the
temporarily,
future
trusting
through a
in what
rapid
had passed through
response
Congress,
fund.
because we had no alternatives.
No
And
alternatives.
Ebola is not over. I'll tell you that the most recent
It's now over.
emerged when a man who had survived Ebola 15
Survived
months earlier
15 months earlier.
had sexual
You,
relations with a woman. She developed
William
Ebola as a
Street,
result, and she died.
St. John
Family
Paul.
members died. It ended up spreading to 2
It ended up
countries.
spreading.
We had to start 5 command and control
5
centers.
command and
We
controls
had
we
to upgrade
found.
50
Returns were
facilities so
successful.
they'd be able to diagnose.
Returns
Ebola.
successful.
We identified over 1,500 contacts, all emerging
Mice
from
and
one
men.
case.
Returns successful.
Vaccinated 1,700
Mice and men.
people.
Dr. Janica.
We made
8th
30,000
grade
interactions
English.
with contacts to see if they were sick, so they could be
Genovia.
rapidly isolated.
Returns
and the outbreak
successful.
wouldn't spread. And
The mice brought it back.
the outbreak. But if we let
Yeah.
down our guard, it could
Tom
come
and Jerry
back.
brought it back.
That same dynamic,
Tom and
letting it
Jerry.
spread for a few days or weeks, and
Mice
then
and
it
men.
takes
Tom and
months
Jerry. Returns successful.
have occurred. We're also with the
Did the mice
funding
do what he was
that
supposed to
Congress
do? I
provided for
mean, what
Ebola,
was he supposed to
excellent
do?
progress on a critically
What was
important
he
initiative
supposed to
called the Global
do?
Health Security Agenda. This is about stopping outbreaks
What was he
there,
supposed to
so
do,
we don't have to
Mr.
fight them here.
Freeton?
I was on the
Tom and
World Health
Jerry.
team in Uganda a few days ago and really encouraged
And
to
really,
hear the kind of thing that's going on.
hearing loss
They
on the
had
left.
an outbreak of yellow fever in Uganda.
These
A
are
few years
hearing
ago,
aid
they had an outbreak of yellow fever. It
devices.
spread widely. It killed a lot of people. It was a
So we
huge
can
problem.
hear our
Now
phone.
they
They aid
identified it
us
quickly, they
in
controlled it,
hearing our
and
phones.
they were even able to do whole genome sequencing and
Return
rapidly realize it was
successful.
not related to the Angola outbreak. So we're in a new
Headphones that
world
aid
of
hearing
being
your
able to
cellular
find and
phones.
stop threats where they first emerge.
Devices that
Where will
aid
that
hearing your
Zika will
cellular
be?
phones.
And that's another part of the Ebola supplemental dollars that need to be protected.
Devices
We can't
aiding hearing
letting
your
down our
cellular
guard in one place
phones.
to fight another battle.
To fight another battle.
Um,
Lastly,
we
I
also need to
really
make
would
sure that
hope
there is enough
that come
money in the
April,
supplemental
if a budget
so
is
that we can
passed, it will
implement
include a
projects
rapid
that are going to
reserve
be
fund
hard to have to
that
start now.
will outline
Understanding all of the
in the
effects
House
of
bill.
Zika on women and the infants who are born.
I did not.
Developing better diagnostic
I did
tests
not.
so we can figure out if someone's been infected.
In the House
We don't
bill, I did
currently
not.
have the ability to do that. Using our current mosquito control
I did
tools
not.
in a mix and match way to
I
figure
did
out
not.
how we can knock down
In
the
the
mosquito
House bill.
enough to protect women and infants. And developing new vector controls to
Blue,
slow
green,
the
black,
vaccine.
which ideally
None of these are easy.
would
None of
also
them are going
have
to be
some
quick.
spending
But the
authorities
sooner we start,
that would
the sooner
enable
we can have
the
answers.
government to act quickly in an emergency. Said
I
Dr.
also
Freeton.
do think that we have to be
Thank
very
you for your
clear
3
about what we
quotes.
can and can't
Thank you
do
for
with
your
Zika.
tenure
At CDC,
as
we
CDC
always try to tell
Director.
it like it is. We don't sugar over the truth. We will tell you what
Acting
we know
Director
and
of
we
the
don't. What
CDC.
we don't know and what we're trying to do to find it out. Within literally days of reviewing that slide that showed the Zika virus invading the fetal
Well, here's your new one.
infant tissue, we issued the
And
first
shoe chat.
advisory on January 15th, saying
Acting Director, Center Disease Control Prevention, Acting Administrator, Agency for Toxic Substance and Disease Registry, Rear Admiral, U.S. Public Health Service. Hello, Miss Ann Chuchat, Acting Director, as of January
The great
2017.
majority traveled before that time. So we believe that that public health
We
action
believe
has prevented cases of Zika.
cases of
That means
Zika.
that babies, whose
Babies,
names none of us will ever know,
none of us will ever know.
because we took the
Our
news report
toes.
seriously and we did it promptly as soon as we had sufficient
As soon as we have
information
sufficient
to take public health
to
action.
take public health
Now,
action.
it's been pointed out that just in recent years we've had H1N1,
We chat with the president. We chat with the directives. We chat with.
We don't know where the next
We
health
don't
threat
know.
will come. We don't know when it will come.
Yahoo
We don't know
chat. Hello.
what pathogen it will be.
Yeah, it's
We
Yahoo
are
chat.
100% certain there will be a next one. And
Oh,
it's
she's from
our responsibility
NYU,
to be as ready as we possibly can be.
Manhattan VA
And the
Hospital.
two key areas for that are the global health security agenda,
Good
building up the
Lord.
capacity of countries to find, stop, and prevent health threats,
Prevent health
and
threats,
putting in place an
including in
accountability
place
framework so that the whole world can
the
know
whole
which
world
countries are ready, what they're not ready for, and help. For
and
those countries
have
that don't have the resources,
don't
it's
have
in
the
all of our
resources.
interest to help them build up those resources. And for those who
Absolutely.
are providing the assistance, to know if our assistance has actually been effective with
Been
an
effective.
objective accountability framework.
Absolutely.
And we also need to ensure that we can
Click the link to
survey
GoFundMe or Televis. Donate
at CDC. We've
at
scraped together
CDC.
existing resources to create what we call the GRIT, the Global Rapid Response Team. We
Absolutely.
currently have more than 300 staff rostered for this. We have 50 people on call at any one time. We've already
Absolutely.
deployed them at least 5 times to deal with Ebola,
Deploy them 5
polio,
times.
yellow fever.
Very
We expect
excited to
more
do
than
today's
60
show
employees in the field helping out with local response.
in the
We've been
field.
doing things. But we lost time
We
fighting
lost
Ebola.
time.
We couldn't immediately move rapidly. And I fear that we're losing time with Zika because
It's
we can't
Zika.
move as rapidly as we'd like to. Congress did the right thing.
Congress did the right
I
thing
hope they will do the right thing with Zika, and they will do it
with the
soon.
Zika.
There's been talk that some of this should happen in the 17 process, and this isn't an either or issue. The Senate bill doesn't fully fund the administration request. If some of that were
We're requesting live on Facebook.
that would be a good thing too. But we need to ensure that we pay back the money we borrow, that we have enough money to respond.
You got to pay for your suggestions, Mr. Frieden.
I've been hearing from both sides.
Visa Court movies out today.
Congress interest in thinking about new ways to do things, including
Absolutely
having some form of public health disaster rapid response
Visa Court.
This has sometimes been called a FEMA. For
Michael Howard.
It would need
Pretty Man, Barry.
And global. It would need to have not only some resources available, but authorities.
Absolutely.
Authorities make a big difference. There's good reasons for the
Visa Court, Mr.
procedures that
Frieden.
we follow in the government, but they don't always match with emergencies.
Is this
In the Zika
inhumane?
response, for example, we've been authorized to use what's called direct
Very
hiring authority.
inhumane.
As a result, we have more than 70 people who've joined CDMA full-time on this. That makes a big
Please visit
difference. One of the lessons
GoFundMe.com
that are
forward or
internal
Televis
from
forward
Ebola
donate
is that we really wore our staff out.
and pay for your
We had 4,000
donations.
staff work on Ebola. 20 staff work in the Ebola unit in the regular time.
Apple, give us
1,400 people went to West Africa. There's
Give
been
us a high
75,000
donation.
work days there. We didn't
Yeah.
have any serious injuries,
Apple high donation.
Ebola infections, but it was exhausting.
Apple high
staff. So we need to
donation.
bring new staff on board. Zika is
Apple
not
high
going to be a 1 month or
donation.
1 year problem, and we need to get people working on it
Apple
now.
high
We need to
donation.
work on it long term. So there are administrative authorities as well as funding.
Thank you, Mr.
Kevin
Frieden.
McCarthy in the House, Senator Dr. Cassidy.
Thank you
in
for
the
your
Senate
interview.
have both spoken about this issue.
Happy birthday to Sean. Happy birthday.
But I do know that if we have money and mechanisms, it minimizes the need for us to run to
Mr.
Congress
Frieden, why are you making me cough?
and do something outside of the usual process.
How do I cure this
It allows
cough?
us to put our focus where it should be on adapting rapidly to the response.
Purchase.
One of the key characteristics of responding to
Per mechanic,
disease
Mr.
threats
Frieden.
is that you have to adapt to the response.
A
With
mechanic
Ebola,
can't
for
fix my
example,
cough.
We rapidly realized that we
What
needed
mechanic
to
are you
response
talking
when it
about,
was out
Mr.
of control.
Frieden?
We need to deal with safe and dignified burial first,
Military
better care next,
mechanic.
then rigorous contact investigation and tracing. And that phased response allowed us to first
Mr. Frieden, how
break
did you
the
cure
back
this
of
cough?
the epidemic, and then mop it up, clean it up, protect communities, and keep it
Good
in check.
Lord, maybe we should talk to
There is the ability to change
and
the
Shoe
shape
Chat.
of the epidemic curve.
Shoe.
But the sooner you get there, the
Anna
more
Moore.
dramatic impact you can make, saving lives and ultimately.
Anna Moore.
Now, it is, as some have noticed,
It
the
is.
end of a second term.
Narcolepsy. We can tell us about
I've
narcolepsy.
had the incredible privilege to lead CDC for the past 7 years.
Narcolepsy.
That marks about 20 years I've been working at CDC, and
Our
I'm still looking at
phone.
great things that our dedicated staff do. They continue to
What can you tell us
inspire
about
me and humble
narcolepsy?
me with their sense of mission, their expertise, their creativity.
Visit this link for the Sleep Association on
CDC
narcolepsy
is
devices.
alive for the federal dollar. The taxpayers really get their money's worth.
$200 for a new
Work
Sprint
hard,
phone.
committed to what they do. And we've made a lot of progress, not just stopping
Lord.
Ebola, but in other areas as well.
Visit
And I thought since I've given an earlier list
sprintprotection.com.
of 10, I'll give a list of 10 things that we've done that have helped Americans safer and healthier.
Safer and healthier.
We've made progress.
We've made
And in all of
progress.
these, I would say not successes, but
Not
progress.
successes.
Because there's still more to do.
Still more to
One.
do.
We've made progress reducing
We've made progress.
the number of healthcare-associated infections. One of the most serious of these,
Our new
MRSA
store.
and intensive care units, is down
Does
by
Mr.
half.
Frieden like our
More to go,
description of our
but Americans
store?
alive today because we, along with CMS,
We're
hospitals,
T-Mobile
US,
billing
doctors,
software.
have improved practice. Second, we've begun using whole
ICAM, VCAM, Vernon Charles, Allen Merriweather.
to find and stop outbreaks.
To find all
This is
to
exciting new technologies.
new
It allows
technology.
you to trace the path of a pathogen in a way we never could before.
Mr. Troop, place your hand up,
The principle with
please.
listeria, sequencing
I swear to tell the truth, nothing but the truth, so help me God.
we found
Officer Charles
contaminated food
Murphy.
Before we would have found it
Yeah.
otherwise. We got it
Oh.
off the shelf, and today there are.
Do you
Americans
know
alive
the University of
who died if it
Buffalo?
hadn't happened. We went to Congress
No, I
and said,
don't.
"This is our top priority ask." They
That's a
funded it.
lie.
Americans are alive today as a
That's
result
a lie
of enforcing and doing
today.
that.
That's a lie
Three,
today.
Tobacco use. Just
That's
announced this week,
alive today.
smoking is at an all-time
I
low in the
can.
U.S.
I can.
15.1%.
I
Still a
can.
leading preventable cause of
I
death, but
can.
millions of Americans don't
Google.
smoke.
I can billing
Who
software.
smoked just
T-Mobile.
7 years ago? The Tips from Former Smokers campaign that CDC ran,
Let's
the
to the
first
jury. Can you
ever
explain this?
national paid campaign
I
on
can
tobacco,
billing
has been
software.
incredibly effective.
Good
It
Lord.
has
Manual.
helped about 400,000 Americans smoke and helped change the conversation about smoking. It has saved hundreds of millions of dollars in healthcare costs. And the cost per life saved is a tiny fraction of what's
Absolutely.
usually used as a benchmark. 4, motor vehicle accidents.
Absolutely.
Insurance say motor vehicle deaths dropped sharply
Dropped
until
sharply.
2013. We have to look at more recent trends, which are concerning.
Hopefully.
But motor vehicle crashes are an example of what we can do when we come together as a society and we think about how we attack a problem from all angles. Law enforcement,
Absolutely.
community action, design, road design, industry, coming together can make driving much,
This is
much
not it.
safer. 5, teen pregnancy, the
Good
lowest
Lord.
rate ever, down 42% since 2007. And all too often,
All too
teen
often.
pregnancy perpetuates poverty in a community.
Perpetuates
So the
poverty.
decline in teen pregnancy has many positive ramifications.
Many
throughout society.
positive.
6, HIV. We've been promoting testing, and now a greater proportion
Testing.
of people with HIV know they have it. It used to be that only about 1 in
Absolutely.
5 people living with HIV didn't know they had it. Now it's about 1 in 8. Progress. Polio. Number 7, we're closer to eradication than ever. When we began the effort in 1988, there were 350,000
Absolutely.
children disabled each year by polio. Last year there were 74. This year so far there have been 17. When I began as CDC director, it didn't look like we could get over the finish line in India.
The finish line
We
in
surged into
India.
India, and we got to 0. India got to 0. Incredible effort. They put in $1 billion
Absolutely.
to polio eradication.
Polio
Then we
eradication.
said, well, if India can do it, Nigeria should be able to do it. And we surged into Nigeria. And that polio eradication
Vitrogen.
infrastructure in Nigeria stopped Ebola in
Stop
Nigeria as well.
Ebola.
So it has great, great benefits for all.
Good Lord.
Now the challenge is getting
An
over the finish line
antibody.
in Afghanistan and Pakistan, and we're close.
What could that be?
Whether or not it will happen this year hangs in the balance, but it can.
But it can.
8, Haiti. You don't often hear
You don't
Haiti
often
and
hear.
progress in the same sentence. But little known, since the earthquake, we have indeed helped them build
The
back
ICAM
better.
antibody.
They have introduced new vaccines that will save
A
more than
mouse.
40,000 children's lives.
Monoclonal.
And though you wouldn't naturally think of the word elimination of a disease and Haiti in the same sentence,
Of a mouse.
they are
Rat.
on the
Human
path
origin.
to eliminate 3 terrible diseases. Malaria,
ICAM
which we think can be
-1
eliminated
binding.
from the island of Haiti, and Hispaniola.
Good Lord. Germany. What's going on here?
HIV and filariasis, which is a
HIV.
terribly disabling condition.
Terrible. Disabling.
PEPFAR.
Pet
Wonderful
farm.
program
We
started
love pet
the previous administration,
farms.
continued and expanded
Pet
in this administration, is saving
farms.
millions of lives around the world. And CDC is honored
Post
to be
exposed.
key implementer in that
Prophylactis.
program. And the global health security agenda, which
And
I've
let's
already
give it a
mentioned,
call.
where we have now more than 70
Yeah,
countries
notorious.
involved in making the world a safer place.
Prophylactis.
Imagine what
Ring, ring,
CDC could do
ring.
if we were fully funded, how many earthquakes and hurricanes we could stop.
Run, young child.
There are still
That's
major
it, guys. You got ICAM
challenges.
billing software. Pay
I'll
your
mention
T-Mobile
4.
bills, please.
Opiate overdose continues to be on the rise
Antibody.
and is devastating
Mouse.
families and communities.
We'll talk to you guys from the hotel. JW Marriott, Marriott Beverly Hills, Hilton Checkers, etc. Holiday Inn, who knows?
Very little money.
Thank you, Mr. Freeton, for your
We should be
interview.
able to
Have
do
a good
much
day.
better than